It's undeniable. The numbers of people suffering from depression and anxiety have skyrocketed over recent years. Suicide rates among young teens have increased dramatically over the last decade, and nearly half of all adolescents report struggling with persistent sadness or hopelessness.
We're seeing significant needs and crises in a lot younger kids. And then in our older teens, we're seeing lots and lots of behaviors of just from unmet needs. And we're seeing really fractured family relationships, lots of behavioral, dangerous behaviors that are happening.
At Alliance, we are committed to the well-being of our young people and dedicated to building a comprehensive system focused on early identification, trauma-informed assessments, intervention, community-based support to minimize out-of-home placements, and crisis response capacity.
The goal is to connect children who are having difficulty in school with providers like therapists and psychiatrists in the community, and to also link those therapists and psychiatrists with the school staff, such as the counselor or the SAP counselor or the principal, when there are issues going on within the school.
Our Hope Center for Youth and Family Crisis, a state-of-the-art child crisis and assessment center in Fuquay-Varina, opened in June 2023. Serving youth and families across the Alliance region, the BHUC provides 24/7 access to expert assessment, stabilization, and treatment planning catered to the unique challenges of young people in crisis. Mobile Outreach Response Engagement and Stabilization, or MORS, dispatches specially trained responders within an hour to help youth and their families in crisis. These responders connect families to resources, reducing the need for hospitalization and out-of-home placements.
Kids end up in emergency departments, they end up in detention, they end up in jail. That's not a place for a kid to be when they're experiencing a behavioral health crisis. This place is a welcoming environment. They can be seen immediately for services. They can get assessed. They can get some basic counseling. They can get some medication if they need, and then hopefully they can go back home. If they can't, then they can go over to the crisis beds. One way or another, they do get connected. That's the whole goal of this. This is not the final destination for a kid. It's a place to get stabilized and then begin that next process of being connected to needed treatment.
Alliance also offers youth mental health first aid to our communities. The course is designed to teach parents, family members, caregivers, teachers, school staff, neighbors, health and human services workers, and other caring citizens how to help an adolescent, age 12 to 18, who's experiencing a mental health or addiction challenge or in crisis.
I love how we're able to collaborate. We're always able to pick up the telephone and call one another. The relationships that we build, the rapport we build with students, families, and staff. The one thing I love the most about the Alliance School-Based team is their passion and zeal to see students and families and staff succeed.
Alliance's award-winning school-based team, in partnership with the Wake County Public School System, works to identify and connect qualifying WCPSS students to behavioral health services. The program provides system coordination when a child is experiencing a crisis or is in transition to or from crisis or residential placements, such as psychiatric residential treatment facilities. Demonstrating our commitment to future generations through innovation, compassion, and service. Just another example of how Alliance and our communities are better together. That's the Alliance way.